Talk to you.
Let's bring in Congressman Stupak now. And Congressman, you heard Secretary Sebelius there. She said the president's bill, the president's proposal doesn't change the status quo on abortion, does not have federal funding on abortion. Do you agree, and can you vote for it?
Well, no one has seen the president's bill yet. We've seen proposals. The president indicated yesterday 4 more proposals he'd like to incorporate, so we want to see the bill. But the bill that they're using as the vehicle is the Senate bill. And if you go to page 2069 through page 2078, you will find in there the federal government would directly subsidize abortions, plus every enrollee in the Office of Personnel Management plan, every enrollee has to pay a minimum of $1 per month towards reproductive rights, which includes abortions.
So if the president doesn't change the Senate bill, you can't vote for it?
Well, no, we're not going to vote for this bill with that kind of language in there. The president says no federal funding for abortion. I have 8 pieces of legislation we currently have in federal law that says no public funding for abortion. Take any one of these 8, insert the language, and we'll be happy and we can support this legislation. We voted for health care before. I want to see health care pass. I agree with the secretary. People are being priced out of the market. We must have health care. But boy, there's some principles and beliefs that some of us are not going to pass.
But Congressman, how can you do that? As I understand the process, that kind of abortion language cannot be tied to the reconciliation bill. It would be knocked out of the reconciliation bill, so there's no way to change the Senate bill.
Well, I disagree with you there, George. We did welfare reform under reconciliation when President Clinton was in. SCHIP, the State Children's Health Initiative program, was passed through reconciliation. You can do it. If there's a will, there's a way. That's just an excuse they're giving. Look, give us our language. Let's keep current law. No public funding for abortion. Let's pass health care. Affordable, quality health care for all Americans. That's what I want to see done.
Have you asked the president to put your language in the bill?
We have repeatedly told his staff, here's what we need. Yes, I had this discussion with the president back in September before we had our amendment on the House floor. You know, it's there in current law. Why they keep saying they want to maintain current law? Take their choice. There's 8 programs out there. Let's just keep the language.
Let me be clear here. If the president doesn't change the language, if your language is not accepted, you and your 11 colleagues who voted yes the last time will vote no this time. Does that mean you're prepared to take responsibility for bringing down this whole bill?
Yes, we're prepared to take responsibility. I mean, I've been catching it ever since last fall. I mean, let's face it, I want to see health care. Yeah, but we're not going to bypass some principles and belief that we feel strongly about. And the president, he's showing flexibility. He's putting in Republican proposals. Look, let's keep current law. No public funding for abortion. Let's pass health care.
And if he accepts your abortion language quickly, will you vote for the bill?
We'll read it. We'll make sure it's a quality piece of legislation. Members are not interested in voting for that Senate bill, that's for sure.
Okay, Congressman Stupak, thanks very much for your time this morning.